Hello, I'm Dr. James Wilson, and welcome back to Senior Vitality Clinic. Today we're going to talk about a topic that nearly every older adult has experienced, yet very few fully understand: joint pain. If you're over 60, chances are you've felt it at some point. Maybe in your knees when you climb the stairs, in your hips when you get out of bed, or in your hands when you're trying to open a jar. You might have brushed it off as just age, something unavoidable, something you're meant to live with. But today I want to gently challenge that belief. Joint pain may be common, but it is not something you must simply accept or suffer through. There is a difference between discomfort that comes with normal aging and pain that signals a deeper issue, something that requires attention, evaluation, and sometimes urgent care. The reason this conversation matters so much is because joint pain often becomes the slow thief of independence. It begins quietly: a little stiffness in the morning, a small ache after garden work, a twinge when stepping off a curb. But over time, these small moments can pile up. They begin to limit your activities. You walk less. You avoid trips. You stop doing hobbies that once brought joy. The pain begins to shape your day, your mood, and eventually, your quality of life. What starts out as something that feels small can grow into a barrier to the life you want to live, and the saddest part, much of this can be prevented if the warning signs are understood early. My goal today is not to frighten you, but to guide you, calmly, clearly, and compassionately. I want you to know the difference between normal aches and symptoms that require medical attention. I want you to understand what's happening inside your joints, why pain increases after 60, and how to recognize the specific signs that something serious may be developing. Most importantly, I want to help you feel confident knowing when to seek help and how to take steps today that protect your mobility for years to come. Let's start with something simple. What exactly is joint pain? A joint is where two bones meet, cushioned by cartilage, supported by ligaments, and surrounded by fluid that reduces friction. When everything is functioning properly, the joint moves smoothly, almost silently, without you ever noticing. But when something begins to go wrong, whether it's inflammation, cartilage breakdown, injury, or infection, you feel it. Sometimes that feeling is mild and temporary. Other times it is persistent, sharp, or debilitating. Many older adults assume the only reason joints hurt is because cartilage has worn away. And while that is one cause, it is far from the only explanation. Joint pain can come from inflammation in the lining of the joint, irritation of tendons, fluid buildup, muscle weakness, nerve problems, autoimmune conditions, or even infections. This is why a proper diagnosis is essential. Without understanding the root cause, you are only guessing, and guessing can lead to delays that worsen the problem. Now let's address one of the most common misconceptions I hear almost daily. Pain has always been part of my life. It's too late to do anything about it. I want you to hear this clearly. Age may increase the likelihood of joint issues, but it does not take away your right to feel better. I've had patients in their 80s who regained mobility with proper treatment. I've seen individuals who struggled for years suddenly walk with confidence again once the underlying cause of their pain was identified and managed. Joint pain is not a sentence, it's a message. And your body is asking you to listen. Before we move into the red flag symptoms, it's important to understand why joint pain becomes so common after 60. Aging affects every joint in your body, but not in the exact same way for everyone. Genetics play a role. Activity history plays a role. Weight, past injuries, and medical conditions all play a role. But there are three major biological changes that affect most older adults. The first is cartilage thinning. Cartilage is a smooth, rubbery tissue that protects the ends of your bones and allows them to glide past each other. Over time, this protective layer can wear down. When cartilage thins, bones begin to rub, causing pain, grinding, stiffness, and swelling. The second change involves the fluid inside the joint, the synovial fluid. This fluid is like natural lubrication. Keeping movement smooth as you age, your body produces less of it. Less lubrication means more friction, and more friction means more pain. The third major factor is muscle loss. After age 50, adults lose muscle mass every decade unless they actively work to maintain it. Muscles support your joints like scaffolding. When the scaffolding weakens, the joints take more stress. That added stress increases pain and increases the risk of injury. When you combine these changes with conditions like arthritis, gout, tendinitis, or autoimmune disease, the likelihood of pain increases even more. But again, increased likelihood does not mean inevitability. Two people can be the same age, yet experience very different levels of pain based on lifestyle, strength, diet, early treatment, and awareness. Now let's talk about the signs that joint pain is no longer something to monitor at home. Signs that tell you it's time to seek urgent care. These are the stop everything and get evaluated symptoms. If you experience them, it is not overreacting. It is not being dramatic. It is protecting yourself. The first red flag is sudden, severe joint pain accompanied by swelling, warmth, and redness. When these four symptoms happen together, sudden pain, swelling, heat, redness, it often indicates a serious infection inside the joint. Joint infections progress rapidly, destroying cartilage within hours or days. Delay can lead to permanent disability or life-threatening complications. Many people confuse this pain with gout, but an infection is far more dangerous. If you also have a fever, this becomes an emergency. The second urgent symptom is pain after an injury that prevents you from putting weight on the joint or moving it normally. For example, if you fall and suddenly cannot bear weight on your hip or knee, or your ankle looks deformed, or your wrist swells instantly after landing on it, you need immediate evaluation. Older adults often believe they would know when they have a fracture, but many fractures in seniors are subtle. A small hairline fracture can cause mild pain but severe consequences if not treated. The third emergency symptom is joint pain, accompanied by chest pain or shortness of breath. These symptoms may seem unrelated, but they matter because they can indicate a blood clot, especially if the pain is in your calf. A blood clot in the leg can travel to the lungs, causing a life-threatening condition. This is not something you wait on, hope improves, or watch overnight. This is a call 911 situation. The fourth urgent sign is when a joint suddenly becomes stuck, locked, or unable to move. This may happen if a loose piece of cartilage blocks the joint or if intense inflammation freezes the joint in place. When a joint is locked, the longer it stays immobile, the more damage can occur. Now let's transition to symptoms that are not emergencies, but absolutely require a doctor's appointment within days. Not months, not years, but days. Pain that lasts more than 2 weeks is one of the clearest signs. Short-term aches from mild overuse should start improving within days. If pain continues beyond 2 weeks, something deeper is happening. Chronic pain rarely improves by waiting. Another sign is morning stiffness lasting more than 30 minutes. A few minutes of stiffness upon waking is normal, but stiffness lasting longer, especially if it improves throughout the day, is a key indicator of inflammatory arthritis. Inflammatory arthritis is not the same as wear and tear arthritis. It needs early treatment or it can destroy joints quickly. Recurring swelling is another reason to get evaluated. Even if the swelling goes down on its own, the fact that it keeps returning signals inflammation. It may be fluid buildup, gout crystals, autoimmune activity, or infection. Your doctor may need to examine the fluid around the joint to pinpoint the cause. Pain that gets worse with activity, especially if paired with grinding or clicking sounds, often suggests osteoarthritis. Pain with rest or nighttime pain can indicate inflammation or structural problems. Decreased range of motion, such as difficulty raising your arm, bending your knee fully, or turning your neck, is another sign that something is off in the joint's mechanics. Finally, if your joint pain comes with fatigue, fever, weight loss, rash, or feeling unwell, you should be evaluated. These symptoms can indicate systemic conditions like lupus, rheumatoid arthritis, polymyalgia rheumatica, or vasculitis. These are medical conditions, not age issues, and they require targeted treatment. Next, let's talk about the most common conditions your doctor will consider when diagnosing joint pain. The first is osteoarthritis. This is what most people mean when they say arthritis. It occurs when cartilage wears away over time. The symptoms often include stiffness after sitting, pain with movement, and mild swelling. Osteoarthritis is common, but it is also manageable. Treatments can significantly reduce pain and improve mobility. Rheumatoid arthritis is an autoimmune disease where the immune system attacks the joints. It usually affects both sides of the body, both hands, both knees, both wrists. Morning stiffness that lasts over an hour is the hallmark symptom. Early treatment prevents permanent damage. Gout is another cause of sudden joint pain. It develops when uric acid builds up and forms crystals inside the joint. The pain is intense, often described as unbearable. The big toe is the classic site, but gout can affect many joints. Gout is treatable. But diagnosis is important because untreated gout can permanently damage joints. Bursitis and tendinitis, both caused by irritation of soft tissues near the joints, are often the result of overuse. They cause pain that worsens with movement and improves with rest. These conditions often respond well to therapy and temporary lifestyle changes. Polymyalgia rheumatica is a condition that affects older adults, causing significant pain and stiffness in the shoulders, hips, and neck. It can make simple tasks, like lifting your arms or getting out of bed, feel nearly impossible. But it responds dramatically to medication. Other causes include pseudogout, infection, small fractures, nerve compression, or vitamin deficiencies, especially vitamin D or B12. So when we talk about joint pain, it is important to understand what happens during the medical evaluation. Many older adults delay making an appointment simply because they do not know what to expect, and they worry the process will be overwhelming. Let me walk you through it in a calm and simple way. When you first sit down with your healthcare provider, the visit begins with a detailed conversation. This is called the medical history. Your doctor will want to understand not only where your pain is located, but how it feels when it started, what activities make it worse, what makes it better, and whether the pain came on gradually or suddenly. They will also want to know if you have swelling, stiffness, clicking, grinding, or locking. Every detail matters. These are clues that help your doctor understand what might be happening beneath the surface. Your doctor may also ask about your lifestyle, your activity level, sleep patterns, diet, and past injuries. Many people forget details from years ago, but old injuries can have long-lasting effects on the joints. Your doctor will also review your medications, including supplements, because some medications can cause joint pain as a side effect. If you take cholesterol-lowering medications, certain antibiotics, or medications for blood pressure or osteoporosis, your doctor may consider whether these are contributing to your symptoms. This part of the visit should feel like a conversation, not an interrogation. The goal is for your doctor to understand your day-to-day experiences and how your joint pain affects your life. Next comes the physical exam. This is not something to worry about. Your doctor will gently move the affected joint through a range of motion, checking for stiffness, swelling, warmth, or tenderness. They will look at how the joint sits when you're resting and how it behaves when you move it. They may test your strength, balance, and ability to perform simple movements. Sometimes a doctor will compare the painful joint to the same joint on the other side of your body. This helps them understand what is normal for you and what is not. Every joint has a story, and the physical exam helps reveal that story. Depending on what your doctor finds, they may order diagnostic tests. X-rays are often the first tool used. X-rays show the bones and help identify arthritis, fractures, bone spurs, and alignment issues. They also reveal the space between the bones, which can show whether cartilage is thinning. Blood tests may be ordered to check for inflammation, autoimmune markers, uric acid levels for gout, signs of infection, or deficiencies. If the doctor suspects something more complex, such as soft tissue damage or a tear in a ligament or tendon, An MRI may be recommended CT scans, sometimes give more detailed views of bones, and help diagnose fractures that X-rays might miss. Another test some patients find intimidating is joint fluid analysis, often called arthrocentesis or joint aspiration. But let me reassure you, this procedure is generally quick and very safe. Your doctor uses a small needle to draw fluid from the swollen joint. This fluid tells a story. It can reveal signs of infection, uric acid crystals from gout, or calcium deposits from pseudogout. It can also determine whether inflammation is present. Although the idea of a needle entering the joint may sound uncomfortable, many patients feel relief afterward because removing fluid reduces pressure inside the joint. So after gathering all this information, your symptoms, your medical history, the physical exam, and the results of any tests, your doctor will discuss your diagnosis with you. This is an important conversation. You should feel encouraged to ask questions, express concerns, and participate in deciding the best course of treatment. Treatments vary depending on the cause, but the goal is always the same: reduce pain, improve function, prevent further damage, and restore quality of life. Let's talk about treatment options in more detail. Most joint conditions in older adults begin with conservative treatments, which means treatments that do not involve surgery. Physical therapy is one of the most effective tools we have. A physical therapist teaches you exercises that strengthen the muscles surrounding the joint, improve flexibility, reduce stiffness, and increase range of motion. Many older adults assume therapy will be too difficult, but the truth is that therapy can be tailored to your exact abilities. Even simple movements performed consistently can dramatically improve joint stability and reduce pain. Exercise, in general, is one of the most powerful medications you can give your joints. Low-impact activities like walking, swimming, cycling, and Tai Chi strengthen the body without stressing the joints. Many people believe rest is better, but prolonged rest weakens muscles, leading to more pain. Movement done safely and gently nourishes the joints by increasing lubrication and circulation. Weight management is also a crucial part of joint health. The knees, for example, experience 4 pounds of pressure for every pound of body weight, so losing even 5 or 10 pounds can reduce knee pain significantly. Your doctor may also recommend assistive devices, braces, orthotic inserts, canes, or walkers, not as a sign of weakness, but as tools that help you stay independent and mobile. Medications may be used alongside lifestyle changes. These range from over-the-counter pain relievers to prescription anti-inflammatory drugs. Some medications target the immune system for conditions like rheumatoid arthritis. Others lower uric acid levels for gout. Corticosteroid injections can provide powerful temporary relief when inflammation is severe. Hyaluronic acid injections may help lubricate the joint, especially the knees. In some cases, regenerative treatments such as platelet-rich plasma injections or stem cell therapies may be considered, although results vary and not all insurance plans cover them. These treatments aim to support the body's natural healing processes. Surgery is generally considered only when conservative treatments fail or when the joint is severely damaged. Common surgical options include arthroscopy, which allows surgeons to repair or clean out the joint through small incisions, and joint replacement surgery, which replaces the worn-out joint surfaces with artificial components. Many older adults fear surgery, but joint replacements today are far more advanced and successful than in past decades. Recovery, rehabilitation, and outcomes continue to improve, and many seniors return to activities they love: walking, gardening, traveling after surgery. Now let's focus on practical steps you can take starting right now. One of the most helpful things you can do is keep a pain journal. Each day, write down where your pain is located, how severe it is, what you were doing when it started, and what makes it better or worse. This journal is incredibly valuable because it helps you see patterns, and it helps your doctor tailor your treatment. When you bring your journal to your appointment, you're giving your doctor more accurate information than you could ever remember on the spot. Another helpful step is to prepare your questions before your appointment. Many older adults leave the doctor's office realizing they forgot to ask something important. Write your questions down so you can feel confident and prepared. You might ask what is causing your pain, what the expected timeline for improvement is, what lifestyle changes could help, and what signs should prompt you to call the doctor again. Bring a complete list of your medications, including over-the-counter drugs and supplements. This helps your doctor determine whether any of them could be contributing to your symptoms or interacting with each other. If it's easier, gather all your medication bottles and place them in a bag to bring to the appointment. While waiting for your appointment, you can try gentle home measures. Applying ice to a swollen joint can reduce inflammation. Applying heat to a stiff joint can relax tight muscles. Gentle stretching can maintain mobility, while rest from strenuous activities can prevent further irritation. But remember, home remedies do not replace medical evaluation if your symptoms are concerning. Think about your home environment as well. Are there parts of your daily routine that aggravate your pain? Do you struggle with stairs, bending, lifting, or carrying? Small modifications like using a grab bar, raised toilet seat, shower chair, or ergonomic kitchen tools can make a significant difference in your comfort and safety. Most importantly, follow up with your doctor as recommended. Many treatments for joint pain take time, especially physical therapy. Some people feel discouraged when they don't see immediate results, but consistency is the key. Over weeks and months, the improvements add up. Joint pain is not solved overnight, but with the right plan, it can be reduced, managed, and even reversed. Before we conclude, let's take a moment to reflect on what joint pain really means. Pain is not your enemy. Pain is your body's way of sending you a message. When you listen to that message calmly without fear, you make better decisions for your long-term health. Joint pain is often very treatable, but untreated joint problems can create a cycle. Pain leads to less movement weakens the muscles, weak muscles stress the joints, and stressed joints create more pain. Breaking that cycle starts with awareness. Awareness leads to early action, and early action leads to better mobility, more independence, and a higher quality of life. So let's recap the most important points. Seek immediate medical care for severe joint pain with swelling, redness, warmth, or fever. Immediate care is also needed for pain after an injury that prevents you from walking or moving the joint, or pain that comes with chest discomfort or breathing problems. Schedule a doctor's appointment if your pain lasts more than 2 weeks. If you experience morning stiffness lasting over 30 minutes, if swelling keeps returning, or if you notice decreased range of motion. Joint pain that comes with fatigue, rash, weight loss, or fever requires evaluation to rule out autoimmune conditions or systemic disease. Joint pain has many causes: osteoarthritis, rheumatoid arthritis, gout, bursitis, tendinitis, polymyalgia rheumatica, infection, fractures, nerve issues, and more effective treatment depends on an accurate diagnosis. When you see your doctor, they will take a detailed history, perform a physical exam, and may recommend imaging or laboratory tests. Most joint conditions are treated with a combination of physical therapy, exercise, medications, lifestyle changes, and sometimes injection surgery is reserved for more advanced cases. You are not meant to live in pain. You deserve to move comfortably, confidently, and freely. The goal of senior health is not just treating illness, it is helping you maintain independence, joy, and quality of life. Your joints carry you through every step, every task, and every moment of your day. They deserve attention, care, and support. As always, remember that the information in this video is educational and cannot replace personalized medical advice. Talk to your doctor about your specific symptoms and needs. If you found today's discussion helpful, please subscribe to Senior Vitality Clinic and click the notification bell so you don't miss upcoming videos on arthritis, fall prevention, strength-building exercises, and daily routines that support healthy aging. Take care of your joints, take care of your body, and take care of your future. I'm Dr. James Wilson, reminding you that with the right knowledge and the right support, your best years can still be ahead of you.